see if that's going to be all right. Let's try that.
Well, hi there, everybody. Thank you, Martha, and thank you in particular to Stephen and Laverne Ross. This is my first trip to the USA, and to arrive in Las Vegas is real culture shock, I can assure you. I haven't actually left this building since arriving. It's like a town in itself. The Chinese, and there are several Chinese friends here today, call America Meigo, which means wonderful country. And that's quite true. It's a wonderful country, and you're very fortunate to live here. Just looking out from our hotel window, which is about 30 stories up, we can see the desert, the mountains, and it's just absolutely wonderful, I can tell you. I'm at a slight loss as to know where to begin. I have 1 hour to try and impart a couple of important messages. If I succeed in imparting those, I'll be happy. I've got a strange background in the sciences, in law, banking, economics, and so on. And for a while that was a problem because I found myself changing from job to job, wondering why I was changing. But latterly realizing perhaps the early part of our lives have a purpose, that they gear us up for the later part of our lives. And I now find myself in a position in the UK of assisting others to bring alternative therapies, complementary medicine, call it what you will, into the mainstream of healthcare practice. And that work is spilling over into Europe with the impending unification of the member states of the EEC in Europe.
Excuse me. We need to just adjust this.
Unless you're going to lean over to one side.
Excuse us, this will be much better for all of us.
You can't hear him.
No, but we'll be able to hear you now if they're moving.
Okay, is that better? Today and over the next 3 days, you're going to hear some remarkable people talking about remarkable developments in healthcare. I've met 1 or 2 already, and I can assure you there are very interesting things going on in the world at large. And I see my task today as describing a perspective, a context in which you can embed all these differing developments. It helps to have that context, otherwise we often find such an avalanche of knowledge confusing at times. The context really is based on my own belief system. It may be eccentric to you. My own belief system is that we are primarily spirit, that the material aspect of ourselves, the body, the world around us, is but one part only of reality. It's the part we have become accustomed to, and it's the part in which most of us live and die. But my belief is it goes far beyond that, and that we incarnate for a purpose. But more of that later. Traveling here, and this was my longest journey ever by aircraft, a 13-hour trip from the UK, one became acutely aware of the size of this small planet. It's a very small planet indeed. And here we are, sort of tucked away, a tiny fragment somewhere in this huge universe, with a massive self of our own, a massive sense rather, of our own self-importance. Wondering if life exists on other planets. What a conceit. But one thing does appear to be clear, that certainly in recorded history, this appears to be the first time in which this sense of planetary awareness has come upon us. We can all now think in terms of the whole planet. Mass communication, telecommunications, and all that, and political changes have made us aware that we are living in one home, in one garden, rather in separate homes, separate gardens. And that is why the work of the foundation, the World Research Foundation, is so important. Stephen and Laverne Ross are remarkable people who've clearly tuned into this awareness and see the potential for bringing together what's going on. They sense that rather than asking questions all the time, which is the mode of modern science, modern intellectual man, they're content to find the answers in the belief the answers actually exist here and now. It's just a question of looking for them. I believe in that too. The answers exist here and now. The answers to our healthcare problems are out there somewhere. But the actual rationale of the establishment of the foundation goes beyond that, because Stephen and Laverne are also aware that all is not well in healthcare, tarnished in the golden age. A lot of problems, and they aren't simply cash flow problems. It isn't a question of finding the cash and making things right. It goes far beyond that. So for the first part of my talk, I shall appear a bit negative, but I don't apologize for that, because it is important that we become aware of the nature of the problem before we can begin to address it. And I call the problem the health crisis. And I'll switch on this machine over here, if I can get across. I just pinpointed. Can you hear me? No. I'll go back.
Well, this should...
It doesn't matter, I'll speak from here. I've just pinpointed two obviously dramatic facts. These are extreme examples of problems. They are both UK examples, but they speak for themselves. We in the UK are a developed nation, obviously. Not as far ahead as you are here, but fairly far up the league in the first world. We are, I think, unique in having the only national health service in the democratic world. Been going now for 40 years exactly. Despite these advantages, we have amongst the worst health record on this planet. These are two examples. The worst death rates in the world for certain cancers and for heart disease. Okay, the question is why? And we'll come back to that. The main reason, I believe, is that in dealing with the large area of healthcare, we focus erroneously on the small area of medicine. We've allowed medicine, which is an academic study, to take over the whole field of healthcare. And that isn't all. We've permitted medicine itself to become a particular kind of medicine. We call it allopathic medicine in England. I think it's called school medicine here, orthodox medicine, whatever. You understand my meaning. There's a certain outlook which some people call disease management. It's an outlook which sees the human body, a human being, as a machine, which sees disease as an enemy, and which justifies virtually any means to conquer that enemy. And we all know the results, the consequences of that approach. If I can just begin to draw attention to some details of this. In Britain, you call it England, but in Britain, our medical care system is almost entirely allopathic. People have to go through an orthodox medical training at a university for 6 years, and then into internship or housemanship, and then specialty. They then become members of the National Health Service, a few become private doctors, but most join the National Health Service. And because of the spread of income and wealth in the UK, most people have to resort to the National Health Service. They cannot afford private medicine. Okay? So you've got a situation with a monopoly of one viewpoint dispensing to the great majority of the population. And there are doctors here, I'm sure, many doctors, but I'm sure most will agree that the practicalities of that viewpoint revolve around prescription drugs and surgery. That if treatment is prescribed, it is usually in the form of a drug or surgery or both. Really different from that. Sometimes radiotherapy, but usually drugs or surgery. Okay? And the doctrine of clinical freedom permits the doctor to prescribe the drug of his choosing or the surgical technique of his choosing. There is no, apart from the law, there is no policing of the system. One needn't resort to one's colleagues for an opinion. The patient does that, but the doctor needn't do that, unless, of course, career is at stake. The success of modern medicine is undoubted. I'm not here to decry that. If I was to summarize where modern medicine scores well, I would say it's in the areas of emergency intervention and mechanical repair. What's gone wrong, however, is that doctors have colonized all other situations and made them medical situations, so that natural things like giving birth or dying have become medical situations. And that's wrong. That clearly is wrong. People have given up responsibility for their own lives, own well-being to experts, and that cannot be correct in the long run. And in the last 70 or 80 years of the success of modern medicine, certain myths have grown up. If I can just perhaps describe a couple, there are many, but two will do. One is that modern medicine and modern drugs are largely responsible for wiping out major diseases. That just isn't true. The statistics show that in TB, typhoid, diphtheria and pneumonia, the death rate per 1,000 was already dropping fast and was quite low before the major relevant drugs, isoniazid, I can't read them, toxoid, sulfonamides and so on, were discovered. They were discovered and introduced at a time when the death rates had already fallen. And yet some people put forward the view that it's the drugs and the techniques which are responsible. It's sanitation and the wider aspects of health promotion which are the main indicators of health care. And in fact, as these statistics here show, illness may be on the increase, despite modern medicine, despite billions of dollars being pumped in increasingly evolved techniques. The second myth is that modern drugs and surgery are both necessary and effective. Now, in some cases they are, and I concede that. But if I can quote a couple of examples here, this is taken from a study published in The Lancet quite a few years back, 1975. But antibiotics are given automatically to patients who have certain types of operations, but a study published in The Lancet showed that infection was 3 times more frequent in those who had received routine antibiotics than those who had not. And again, NSAIDs are used to treat conditions like arthritis. But despite their cost and often elaborate claims, none of them are superior to aspirin. Now, I understand the lion's share of the profits of US drug companies. Another one. A National Academy of Sciences panel studying the effectiveness of drugs in the USA in the mid-60s found that over half of these drugs were either ineffective, or at least ineffective in the form prescribed, or at very best, possibly effective, and I quote. On the question of surgery, just one example, there are, according to recent figures, about 2.5 million unnecessary operations performed in this country every year, causing about 12,000 deaths and costing $4 billion. Now, I can go on and on and on, but to no avail. I'm just repeating the message ad nauseam. The point I want to make is that all is not well in the garden. One additional point is the amount of illness which is now caused by medicine, the side effects of drugs and surgery. That aspect is growing fast, certainly in the UK. The figures here are difficult to find because it's difficult to measure this kind of illness, and doctors are understandably reluctant to agree to them. But for example, 1 person in 10 who enters hospital in this country as an inpatient picks up a new illness in hospital. And again, this is the USA, 2 out of 5 people receiving clinical drugs have side effects. Okay, that's known. Drugs do have side effects. But in many cases, these side effects are much more serious than the condition being treated in the first place. Okay? The cost of dealing with the side effects of drugs in this country is estimated at $3 billion per annum. And if you concede the figures which are now coming are approximate, the number of deaths per year due to drug accidents or imprudent or excessive prescribing in the UK is 15,000. In this country, it's 60,000, which in fact exceeds the number of road deaths. Okay? Now, whether you agree with all of this or part of it, I think one has to agree that it's a sorry state of affairs. And if I can walk across again and show, let's try and summarize this. That's just a very brief summary of what I've said. There's far too much ill health in the world at large. The existing healthcare systems cannot cope, and it isn't just a cash flow problem. Health promotion, the wider aspect of preventative medicine and promoting good health, takes second place in cash terms in favour of disease management, because the latter is far more prestigious. And item 4, much treatment in medicine is unnecessary or expensive or ineffective or even dangerous, or any combination of those 4. Now that basically, at least in my opinion, is the cause of the health crisis. That is the health crisis. So what do we have in medicine? How can we summarize the present healthcare system in order to try and rectify some of the faults? contrary to Hippocrates' dictum of at least do no harm. In fact, we find we are doing harm. Secondly, we concentrate on symptoms, the gross, superficial symptoms, and we tend to ignore the deeper causes. Now, often that's justified in emergency cases. Clearly it is, but often it isn't justified in chronic cases. Medicine is not economic. It costs far too much and it needn't. Nor is it ecological. I'll come back to that one. I think that the most important feature of all this is the fact that the way healthcare is delivered, certainly in the Western world, is that it creates a dependency mentality on the part of the individual, the patient. The patient becomes increasingly dependent on others, on experts. They run to the doctor for everything. And in the process, they lose themselves. And lastly, it's disease-orientated. It's textbook medicine. Medical textbooks are based on a classification of diseases. And if it doesn't fit into the category, you somehow avoid the patient or avoid that case. You try and pigeonhole the patient. Rather than looking at the patient, you try and get the patient to fit into a category which has been preset for you in your training. Okay? Now, if we can use that as the model and say, all right, if we accept for the time being that is the health crisis, it suggests that if we change each of the 5 aspects and look for their opposite or their counterpart, we can begin to move away. Let's try and do that. Right back to Hippocrates in number 1, do no harm. It's worth dwelling on that one because one of the criteria for assessing the efficacy of a clinical drug, the FDA process, the Medicines Commission in my country, is the risk-benefit ratio. So long as the benefits of the drug outweigh the risk, then it's usable. Well, the problem there is that the ways of assessing the benefits and assessing the risks are often very suspect. And quite often it isn't possible to assess the risks of a drug until years afterwards. Secondly, treat the causes. It should be causal medicine. We are an evolved race, and it's high time we learn to go deep. It's our potential to go deep. And as healers, doctors, healthcare practitioners, it's a duty to go as deeply as possible. Otherwise you just skim the surface and the problems just come back again and again in different form. Ecology, a buzzword. The planet is in a state of crisis and will carry on in that state unless we address the nature of that crisis. And the nature of that crisis is that we are here as custodians, both of ourselves, our fellow men, and of the planet. It's husbandry. Item 4, perhaps the single most important feature of the AIDS syndrome is that the people who exhibit the serious symptoms of AIDS and often go on to die always exhibit one symptom, a loss of the inner self, a dependency mentality. Lack of self-assurance, lack of self-assertion. The dependency has gone so far, it has spilled over into physiology. Lastly, another buzzword, holistic. It should be so obvious that we treat the whole person, and I accept many, many doctors do, but not all do. And the training lacks a lot in that respect. Certainly in the UK, the amount of time devoted in medical training to say nutrition is 1 hour in 5 years. That's a concession. And when it comes to counselling, social training, the wider aspects, the important aspects, that is left until after you graduate to postgraduate training. Or it's left to the vagaries of chance, hoping the individual picks it up. People will differ on this, but that's my own view of what good healthcare, good medicine should look like, based on these things. And it's obviously high time, I feel, this view is incorporated into the world view of those who teach and practice medicine. I've been negative for about 20 minutes. I do apologise. I don't mean to be negative, but I think it's very important to at least gauge the nature of the problem and accept it, even just for the time being, to find out the possibilities of change. One very interesting feature of this is that you can actually make a comparison with lifestyle. Just look at this. I've written down lifestyle with a subtitle, health promotion. I think it's one and the same thing, quite honestly. You'll see that each of the 5 points matches the 5 points on the previous list. I've just extended it from the narrower field of healthcare to the wider field of lifestyle. But it's the same thing, basically. And that should tell us a great deal. It should tell us that in looking at questions of health, we are ultimately addressing larger questions, questions of our whole attitude and our lifestyle. In other words, it might be quite unwise to dwell narrowly on the field of healthcare and forget that the whole thing has to be embedded in the wider context. So again, do no harm to ourselves, our fellow creatures, and the planet. Again, it should be obvious, but it obviously isn't. Biggest items of spending in this country, in my country, are on so-called defence. The jungles of the tropics are being ravaged in the cause of profit. That'll carry on unless we address these things. I've said be aware, be centred. That sounds rather hackneyed, I know. You've heard that kind of phrase before. But it's important that we are centred. Otherwise, most of our efforts are half-hearted, fly off at a tangent, and are inefficient. We can be much more effective in life if we remain centred. Our words acquire much more power. Our actions acquire much more efficacy. Ecological, I've touched on that already. This business of independent and self-assured with an asterisk showing AIDS. I've met many people now who've had AIDS in the past and who are now perfectly healthy. And somehow that fact hasn't filtered through to orthodox public opinion. It's still regarded as a virally transmitted disease, which is a death sentence. And it's put across, rather like the witch doctor in Africa or wherever would tell you you're about to die. I've known people who have died because they've been told that. And lastly, the widest possible context for our lives. What does that mean? It means that if we are prepared to take time, just a few moments each day, and ask ourselves, well, who am I, really? Why am I here, really? And what am I doing? Naturally develop a context for yourselves which will allow the details of life, healthcare questions, to fall into place. Next question, is this all very practical? I think it is. I know people preach this kind of thing around the world these days, but it's pointless in preaching it unless at least a dozen of you go away and begin doing something about it. I wouldn't be here today, I'd be gambling instead, if I didn't believe it was possible to actually put things into practice like this. It's difficult, but that's why we're here. But life isn't easy. There are political constraints. Certainly over here, it's quite tough. The land of freedom and democracy is extremely tough. Very unfree, certainly in medicine. I had a quote somewhere, I can't find it doesn't really matter, describing how several healthcare practitioners, homeopaths, nutritional experts with cancer patients, were advising patients using very common sense techniques to me. And because they were even putting forward these ideas, they fell foul of the law, heavy fines or imprisonment. I found it hard to believe that. I've always regarded this country as the land of the free, but apparently it happens. Apparently this state, Connecticut, and one other state are fairly free. Other states like California are far from free. I can tell you that from where I come from, we are regarded by WHO as the most tolerant system on this planet. You can do what you like, as long as you don't fall foul of the common law. In other words, if something goes wrong, the patient can sue. Having said that, patients haven't quite reached the suing level you find over here. So homeopaths practice freely, herbalists, chiropractors, in fact anyone. The huge spectrum can practice freely, and it's causing no problems. People benefit from it. Doctors work side by side with these people. It is complementary medicine. But we must recognize there are vested interests. People have a career to maintain, profits to maintain, a power base to maintain or enhance, whatever. Human nature. So it'll be hard. But I'll be drawing attention in a minute to the situation in my country and in the EEC, because, at least according to Stephen and Laverne, what may happen over there in Europe could be the blueprint for what happens here. In other words, you'll be looking with one eye cast across the Atlantic to changes over there. I should say that World Health Organization has actually classified healthcare systems formally. There are 4 categories. One is integrated, and that's the Chinese system, where in China you learn ancient techniques alongside modern techniques at medical schools. The Chinese regard that as perfectly sensible, perfectly pragmatic, and they know it works. I've forgotten one of the categories, doesn't really matter very much. The other 2 categories are tolerant and intolerant, respectively. There are 2 tolerant healthcare systems in this world. One is my country, the other is West Germany. All the rest are intolerant. One of the most intolerant is here, where we are just now. And what that means basically is that anything which is not school medicine is discouraged, either passively by exclusion or actively using the process of law. And needless to say, the drug industry is actively involved in that process. So one has to be aware of political realities and constraints before you even begin to decide what to do about things. So far as the UK is concerned, it's worth classifying the situation into 2 parts. 1, the therapies, and 2, products or medicines as such. First of all, products. All medicines are reviewed by the Medicines Division, more like the FDA. A medicine in Britain is only a medicine if it says it is. It has to actually say so on a label or an advertising or something. In other words, if something says for arthritis, it becomes per se a medicine. If I had dried prunes in a packet which said for constipation, that would require a medicine's license. But dried prunes by themselves wouldn't. That's the food regulations. Like over here, they are assessed for safety, efficacy, and quality. Quality is not a problem. The manufacturer deals with that. Safety, so far as homeopathy is concerned, not a problem because of the great dilutions. Efficacy, a great problem. And here is where the worldviews come into conflict. One worldview says, well, look, this is below Avogadro's number. It can't exist, therefore it can't work. And you may have seen an article in Nature quite recently describing an experiment purporting to show that very high dilutions were effective. Well, the fact is, in our country, the Medicines Division recognises homeopathy officially and is willing to give medicines licenses to those manufacturers of homeopathic products who can prove or establish rather certain criteria. So we will see licenses quite soon for a large number of products. In total, there are 15,000 provisional medicinal licenses for alternative products in Britain, herbal, homeopathic and so on. The only real problem is that if you make a claim that your product is for a serious disease, and there's a formal list of these, venereal diseases, stress, some kinds of stress, heart disease, cancers and so on, then the rules are far more stringent and you have to carry out clinical trials. Okay, at first sight that sounds quite reasonable. In my view, it's a complete nonsense. I regard the paradigm, the modality of a clinical trial as being highly suspect. Most of you won't know that about 12 years ago in West Germany, the government became a bit suspicious of clinical trials because of the number of side effects showing up years later in drugs that had passed as safe or at least suitable. So it commissioned a study of 2,000 prescription drugs in West Germany. And the people doing this, Burkhardt and Kienler, I can give the reference afterwards, asked the drug companies to send what they regarded as the best clinical trials, the blue chip ones. And altogether there were 2,000 tests or reports passed in to be assessed. Of those 2,000, only 19 were regarded as satisfactory. As a result of that report, which is a bulky report, the West German government withdrew a large number of drugs and changed its impending drug legislation. It established medicines commissions for the different philosophies of medicine: homeopathic, anthroposophical, herbal, and allopathic. Each were allowed to evolve their own methods of assessment independently. Now, this is a fairly new system in West Germany, but so far it's working reasonably well. There are teething problems. The fact is that a government was willing to recognize that one's philosophy of medicine, allopathic, isn't necessarily the only right one. There are others. There's a place for them. I got the light just now to say 15 minutes until I close. Can I state the obvious by saying that to make any progress in this field, we require three things. We require political will, obviously. And here I'd refer you to the consumer revolution taking place in Europe and over here. What's happening now, the changes taking place in healthcare are consumer-led. It's because your patient is moving away or demanding new things that you're responding. And this applies to manufacturers also. Some are dragged by their heels, but eventually come across. The second thing you require is coordination of effort. No point in having the right ideas but sitting across in a corner thinking about them. We must work together. In the UK, we've established a working party which brings together 1,500 different groups in alternative medicine. We disagree often, but at least we have this forum for talking, which is very important. And that forum is seen by our legislators as the place to go, to whom to speak. The third thing we require is free-flowing information. And this is where the foundation comes into its own, in recognizing the need. If you wish to put forward an idea in a case, you must back it up with information, with data. And I believe that the foundation, as it gets going, will be a prime source of data. Can I round off by going off at a slight tangent and talking about what I believe to be the single most important development in healthcare consciousness, and that is, to use the term we use over there, is vibrational energy, vibrational healing, vibrational medicine, whatever, an understanding that everything is simply vibrational energy, ourselves, solid objects, the atmosphere, everything. That we can think in terms of energetic medicine. It's a new perspective. And I believe that will have profound implications for everything we do, both in our lives and in our work in health care. If I can just illustrate very quickly what I mean by all this. Well, you've seen that before, I guess, but that's my own interpretation of what's now known as the holistic worldview, that this is one universe. Just like a motor car is an integral thing, the universe similarly is integral. And that means, if that's true, that everything in it is somehow related in some way, which we cannot fathom yet, but in some way. It also means that every single aspect, thing, system, whatever, is part of something greater. It means, tantalizingly, I think, that everything, no matter how modest, how humble, contains the essence of the whole. The universal essence is contained in every small part. And latterly, it means we can now begin to break down barriers between the world of spirit and the world of matter. If we can see things as simply levels of octaves, vibrational octaves, we come eventually to the conclusion that the solid world, the world of matter, is at one octave. As we go higher in frequency, we get subtler and subtler levels of reality. The fifth point, energy traditionally is thought of as something quite physical. What I'm saying to you now is that energy is the all, it's everything. And if it is everything, then consciousness, which is part of our way of being, is also part of energy. In other words, there's an equivalence of the two. It's a way, it includes everything we could possibly think of, including spirituality. And I use the word octave because it's convenient. It describes scales of frequency. And the last point is, to me, perhaps the most significant point. Rather than having a compartment for the physical world and that aspect of our lives, another compartment for Sundays, for churches, for spirit, we bring the two together. I think that's a lesson for the times we live in. We dissolve these barriers and see them as part of one whole. Right, I shall finish in about 5 minutes. If I was to go away and leave behind one message today, it would be this: that health is a spiritual matter. That the primary task of anyone involved in health care is dealing with spiritual health. As long as we concentrate on the physical aspects of health, we shall carry on going around in circles. And we'll repeat the same mistakes again and again and again. Only when we begin to address the deeper fundamentals will things fall into place for us. So what I'm saying here, number one, is rather like Willis Harmon, California, has said, that rather than matter being primary and spirit and mentality being a derivation of it, we turn the thing on its head. Reality for us is spiritual, and matter is an aspect of it, a dense, arrested form, if you will, of cosmic substance. Incarnation is a controversial issue, but I mention it only because, well, one, I believe in it. I believe we incarnate voluntarily for a purpose. And two, it's becoming abused. People begin talking about past lives rather glibly, and I think it's time we were a bit more rigorous and evolve techniques for understanding ourselves first before we branch out, I think, dangerously into that area. Number three, why are we here? It's my view only. It's why I think I'm here. I think we're here to make this planet a better place. I think we're here to make ourselves more highly evolved and others around us. And one way of expressing that, just one way out of many ways, which ties in with the idea of health care at a vibrational level, is that we're here to raise the levels of vibration of everything, even the stones, everything, our consciousness, okay? If we can all raise everything by 1 octave in a lifetime, that's good going. I thank you for your time. Thank you.